Hello, colleagues, and welcome to our panel discussion during Humanitarian Networks and Partnerships Week. This session is going to focus on inclusivity in focus, implementing a person-centered approach to security risk management. Our personnel are at the forefront of providing life-saving assistance and protection to vulnerable populations in some of the most challenging and dangerous environments around the world. Over 235 million people worldwide require humanitarian assistance, and UNHCR predicted this year that the number of people displaced by violence and conflict will reach almost 63 million. With unprecedented levels of humanitarian need, more than ever, we need our most important asset, our staff, to help us help others. Ensuring staff security enables our colleagues to carry out their life-saving work effectively and without fear. It's essential for maintaining humanitarian access to affected communities, and it's critical for upholding humanitarian principles and fundamental to the credibility and the effectiveness of humanitarian delivery. By prioritizing the security of humanitarian personnel, we demonstrate our commitment to protecting those who dedicate their lives to serving others and to uphold the values of humanity and inclusion. The targeting of individuals for violence based on their identity is a manifestation of discrimination and prejudice. Whether motivated by factors such as race, ethnicity, religion, gender, sexual orientation, or tribal affiliation, such targeted violence not only inflicts harms on our individual staff, but it also undermines the very fabric of society and the communities we work in. Perpetrators seek to instill fear, assert power, and perpetrate cycles of violence and hatred and division, eroding social cohesion in the community. Adopting a person-centered approach within security risk management is not only essential to increase, but it's also increasingly urgent. At the heart of a person-centered approach to security risk management lies the recognition that diverse personal profiles of staff and the nuanced context-specific risks they may face. Today, we embark on an exploration in this panel on how security risk management can be holistic and can integrate these diverse characteristics, ensuring that considerations are made for factors such as gender or sexual orientation, gender identity, tribal affiliation, religion, ethnicity, and more. Preventing, mitigating, and responding and condemning security incidents that are targeted based on someone's identity requires concerted efforts to promote tolerance, equality, inclusion, and respect for diversity. Only by fostering inclusive teams, organizations, and communities that embrace and celebrate differences can people, including our own staff, live free from fear and discrimination. Today's panel brings together experts and practitioners from a diverse field to explore the principles and challenges and best practices associated with adopting a person-centered approach to security risk management. They will share real-life challenges and opportunities they encountered when navigating these complexities in a manner that upholds the dignity and safety and well-being of personnel, ensuring that no one is left behind. In the spirit of collaboration and collective learning, we have a question and answer session as well at the end of the panel, in which we hope to be able to answer your questions and have a dialogue with you on this important issue. The panel will last approximately 1 hour, and we'll have around 20 minutes to have questions and answers with you. So as the panel is ongoing, please put your questions and answer into the Q&A function of the Teams, and we'll get to that after this panel discussion. Before we start, I want to introduce you to our panel members. We're joined today by Florence Pousson, the Deputy Director for the Division of Field Operations in UNDSS. Welcome. Marika Peruganen-Atkins, Security Policy and Training Officer in IOM. Melanie Murphy, Director of Physical Security for Human Rights Watch. Sanya Potrovic, Regional Security Specialist in UN Women. Emily Timrick, Director of Health Operations in Catholic Relief Services, or CRS. Ali Saini Lee, the Senior Field Security Officer, Senior Security Coordinator, for UNHCR. I'm Bridget. Nice to meet you all. I'm also with UNHCR as a Field Security Officer, and I happen to also be today's moderator, where I hope to guide us through this discussion. First, to kick us off, I want to turn to Melanie. Melanie, why is it crucial to adopt an individualized approach to security risk management, considering the diverse personal profiles and context-specific risks of personnel? And could you perhaps tell us a little bit about how you do this in Human Rights Watch?
Sure. Thanks, Bridget, and hi to everyone on the call. So at Human Rights Watch, our work centers around investigating and exposing human rights abuses around the world. And what we find is that within the human rights space, the threats that our staff face are really related to factors stemming from their individual identities, the type of work that they are doing. So what kind of research specifically are they working on? And then the context, both of where they are doing that research and if they're doing it on a spot where they're not actually based in, but might be doing it remotely, what's happening in that context as well. So we always look at risk and threats from those three perspectives. And because specifically the identity and type of work that our staff are doing is different for everyone, we can't assume that what's going to work to manage risk for one person is going to manage risk successfully for someone else, even if they're working in that same context. So an example of how this plays out is that all of our security planning is individualized. Our staff all have their own risk levels that relate to that intersection of identity and context and work. And all staff who have a risk level assigned to them of high or extreme have their own personal security plan that they develop in partnership with the security team. In part, this is because we don't work in large teams like many of you in the humanitarian sector do. So for example, we'll have one staff who might be our country researcher for Indonesia, and they're the only staff that's working in that country. And that identity base really brings a significant amount of risk to them because often they are known as the Human Rights Watch researcher in that location. If we are investigating human rights abuses perpetrated by the government, for example, the government knows who that person is and where they live and what their families do. So the risk is much higher for people in that scenario. And so when we create these security plans with that staff member, we always try to center that person's concerns as well. So, I have worked in other organizations where the expectation was that the security person would come in with this long list of risks and threats that that person will face based on context. We don't do it that way at Human Rights Watch. We first say, what are you concerned about? How does this concern play out in your day-to-day life? How does that carry over into work? How does it carry over into your family's life? What are you doing about it right now? And then how can we help? How can we add more value and make this a little bit easier for you? And just as an example of how protocols might change from person to person, we have a number of staff who have public profiles with the organization. They're the people that if you are following us on X or on other forms of social media or reading our reports, have their names attached to us. They have their faces attached. They're speaking in press conferences, for example. But we also have a large number of staff who don't have public profiles at all. You'll never find them anywhere online associated with us or our work. And that's just because the risk level for them of being public is much more substantial.
It's so interesting to hear about Human Rights Watch and how they really individualize risk assessments, and staff security is at the forefront of that discussion. I'm interested to hear from a larger organization, and so I'm looking at you, Florence, in UNDSS. The UN has a common system approach with hundreds of thousands of people known as the United Nations Security Management System. Could you tell us some of the achievements and some of the challenges in implementing a person-centered approach in your organization and across a bigger common system?
Yeah, thanks, Bridget. So the difference with Melanie and the organization, the Human Rights Watch, we have a very large organization. We cover 180,000 UN personnel. We have also a large workforce that we need to, educate, and we need to convince about the person-centered approach. So I think, what some of the achievements that we have seen in the last few years. First is that we have adopted, as the UN Security Management System, the person-centered approach as an integral part of our policy framework. It's part of our most, important policies in the since 2021, and it has been enshrined in this thanks to actually one of these conference that GISF organized in the context of the humanitarian network partnership week a couple of years ago. So it's something that is very important. We have also in the system some successes in the sense that agencies, individual agencies have also taken this and have implemented it, very actively. And of course, UNHCR is part of them, UN Women, is part of them, IOM, those who are on the panel today. And DSS is also trying to implement it, as much as possible. So what we have seen as a success, if you want, we have seen, a change in the number of the physical security measures that are implemented on the ground. Female guards for body checks on the for visitors, for instance, or building evacuation procedures for personnel with disabilities, assembly points. These kind of measures that are very concrete. We have seen also a number of procedures, specific SOPs to enable personnel with different type of profile to operate in the field. We have seen also a lot of training. Of course, our training, major, most important training is the WSAT. I was visiting Ecuador last week. They had a number of sessions for WSAT incorporating UN staff, NGOs, and also partners from the military and the police, which whom they partner and work with. Where we are, we have also a number of residential security measures, and measures for the transportation of people as well. I think where we are lagging and where it's difficult is to have consistency in the implementation of our person-centered approach. That's what we are working on, and we'll be working on, continue to work on with the different agencies. Thank you.
Thank you, Florence. And I think one big area that has been a huge achievement of UNDSS and some of the common system agencies also is also a diverse workforce. And I think we're making a lot more strides, and DSS is really leading on that side. So that's really amazing to see. Lee, I'm thinking of turning to you and UNHCR. How does tailoring security measures, some of the measures that Florence actually mentioned, meet the unique needs and characteristics of individuals and contribute to enhancing overall security and effectiveness within humanitarian organizations?
Thank you very much, Bridget. Good afternoon from Nairobi to colleagues. So I think Melanie has touched on some of the individualized assessments. As you know, each of us is a combination of many things. Some of us have disabilities. We have the different profiles, genders, sexual orientation and identity. We have also different religious backgrounds, nationalities, ethnicities, and these are called intersectional factors, right? So all of these elements actually overlap, and as a result, we do experience risk differently. We do not experience risk equally. I think Melanie gave some examples from Human Rights Watch. And I think this is also valid for actually many settings and environments where we're working on. If you heard yesterday, Paul Farrell talked about risk being an organizational contract and also a personal perception. So it's important for us to differentiate risk management measures which need to be put in place so that we ensure that everyone is operating within levels of acceptable risk, and that is very important because the PCA framework gives us this granular work and assessment to making sure that we are looking at individualized cases and to bring individualized answers. So that takes us to adopting an intersectional approach, whereby we take into consideration all pieces that form our identities, and so we consider all these in the stages from security management when we start the assessment, development of measures and their implementation. So the whole phases, we're making sure that we look at things from a PCA, from a person-centered approach lenses. So that helps us to look at things more holistically and more completely. So now, as security professionals, that's why we need to ask ourselves so many questions, such as I think Florence touched on evacuation, the procedures for example, colleagues with disabilities, right? So this help us as security officers to start thinking from the outset. Are our bunkers, our safe rooms, our procedures, our SOPs, tailored to support colleagues with disabilities? And also, are they gender sensitive? Are they gender responsive? So these are really the lenses through which we are looking at this PCA framework and approach. No, so that is actually the thought process we invite colleagues to work on, and that is really the new way now we really doing our work in the field, and that's the way also we set up, we conceive our documents to ensuring that all of these elements are taken into consideration. So, as I used to say, as security staff members, we are generally the first point of contacts, and this initial interaction is very important that we ensure that all colleagues feel included, feel actually part of the team, and that is the first step to making sure that colleagues are comfortable coming forward and sharing their disabilities. And most of these disabilities are, as we discussed previously, can be actually invisible. And it's important that we have this mindset and attitude to ensuring that we create an ecosystem where everyone is accepted, everyone is able to be satisfied with the differences. And also that's how I see how we can ensure that we support everyone, and globally we support the operations, ensuring that we can stay and deliver, and also to making sure that we maximize program delivery while we minimize risk. So these are my first reflections on this question. Over to you. Thanks.
Thank you so much, Lee. And I think the key thing here that I want to take forward to question to Emily is, how do we get to understand these intersectional factors and what people need? So Emily, how does an organization or a team get to understand the needs of a certain context or a person or a group of persons that might be culturally appropriate or relevant in that context?
Yeah, thanks, Bridget. I think we're all touching on similar themes, right? Which is the first thing you do is you start to seek and understand, and don't make assumptions or assume that there is going to be a one-size-fits-all approach that will work for every team or every group. We know that just within one country program, there is a diverse team that all have different needs, different priorities, and or may respond differently to certain approaches. So for me, that really starts with first seeking understanding, two, then starting with the needs assessment. And we've introduced a couple initiatives over the past year from the health side of things that really underpins that approach. The first is our health capacity assessment, which aims to assess local health resources, identify gaps or risks, and develop a plan to mitigate the risks. Each assessment requires that there is a partnership with our local management team, and then a deep dive into the many aspects that influence the local health infrastructure. This could be, again, the risks, the threats, the health facilities, the resources, internal transport capabilities, etc. It's not for me to say, hey, here's where I see the gaps, here's where I see the challenges. I want to hear from our staff. And oftentimes just sitting with them and spending time listening and learning really helps strengthen that understanding. And then we can make sure that our approach is tailored to meet their needs. The second initiative would be our psychosocial support capacity strengthening initiative, which starts very broadly at kind of a macro level, surveying each country program to identify how they what they would say are their top stressors, what their current staff care and well-being trends are, specific cultural context and or practices that are important or really a priority for them, and then works again with our local leadership team to develop a plan to strengthen their resources around psychosocial support and response. And again, it's important to understand that our approach is similar, but yet the body of work that is involved can look very different from one program to the next, right? It really has to be tailored, and it really has to be individualized to meet the needs of the team. So again, often hearing directly from the staff will help inform our approach. More and more, we are emphasizing the importance of our local leadership, really leading these and them being the ones to engage and direct when it is appropriate for us to expand these initiatives, when it's appropriate for us to engage with the teams at this level. Thanks, Bridget.
Thanks, Emily. I think this is something that really resonates with me in the security space. Whilst I know that the initiatives you're mentioning are medical or psychosocial, I think this is really can be used in our space. You know, how do we have a temperature check of what is the situation for colleagues on the ground? What are the gaps? What are the needs? You know, what processes do we have to assess that? And are we actually really listening? You know, a lot of countries, we've been trying to set up, you know, groups where we get together with staff from a broad section of staff and say, you know, what are you worried about? What are you concerned of in your house? Things like this. So to really understand what are the needs, how are we listening to others, but also what's the gap analysis and needs assessment on the ground in terms of whether or not that environment is welcoming and inclusive or not. I want to pivot a little bit now to planning. And I'm hoping UN Women will be able to help me on this question. Mainstreaming person-centered approaches in security risk management and security planning is critical for ensuring a thorough assessment of risk in the context, but also in contingency planning in case something happens. Sanya, could you talk to how this is done in UN Women?
Absolutely, Bridget. And it's a very important question because now we come to security risk management and planning, right? So what we want to see and what we are seeing now is shifting focus from having purely technical oriented assessments to actually considering the needs, capacities, and vulnerabilities of programs and of individuals in a certain context. And I can tell you from perspective and experience of UN Women, because we have for past 7 years implementation of mainstreaming of security and safety into our program and projects. And just to tell you a bit about that, the way how we do that is we talk to colleagues who conduct programs and projects. What are their priorities, what are their needs, and what are their concerns? So we applied now this into approach where we want to talk about person-centered approach. We take it further. We talk to colleagues about their individual concerns and individual vulnerabilities. And as you said, and as Emily said, and as Lee said, the dialogue is really important, because we find that measures that are agreed between us and colleagues are a much better option than imposed measures. So we give this opportunity for colleagues to feel empowered, that we find measures that fits them and they can use, and having this conversation actually allows us to do so. I think it also promotes the ownership of security measures, and it enhances their effectiveness if colleagues are involved in this conversation. And when we look at security risk management and plans, in UN Women Security Team, as security team, we look it through different lens. So I, as a security person, and as well as my colleagues, we ask ourselves, how would I, if I were a certain gender, nationality, race, origin, ethnic group, minority group, a person with disabilities, would feel about this specific measure or specific plan in this specific context? Would this work for me? If the answer is no, then we need to simply work further. And I think this is a good exercise that we are applying in our organization, and we are promoting that all colleagues who work in a group, because in the countries we work as one UN, all agencies are network in the network, that they ask themselves the same questions. And I think based on that, the measures and plans that we have in place are much better than previous. Thank you, Bridget, for this question.
Thanks, Sanya. No, I think it's important to talk about agency and the roles that the colleague plays in terms of ownership. Lee, UNHCR has a very robust personal security risk assessment process. It's aligned to the existing security risk management policies and processes and organizational duty of care, but the broader UN security management system policies. The UNHCR PSRA is context specific and it's timely and risk bound to ensure that all staff or all personnel operate within acceptable levels of risk. Can you explain a little bit about what the personal security risk assessment process is, and provide a little bit of an explanation of when UNHCR might use a PSRA or a personnel security risk assessment?
Thank you very much, Bridget. So UNHCR developed a personal security risk assessment. This was a consequence of this came out of our witness support project. So for us, the PSRA is really a critical tool to assess the risk and look at the particular risk profiles, as we said before, for both UNHCR personnel, and this is expanded to people under our mandate, which are the forcibly displaced and the stateless persons. So we also use the PSRA tool to also provide the support which is required for them. And this tool is also covering other UNHCR personnel, such as partner staff members, for example, our implementing partners in the field. We also use actually this tool in some specific circumstances. For example, I can give this example that, for example, when we have we used it in our witness support programs, survivors, and also whistleblowers within the context of investigations. We have also used the PSRAs recently for colleagues who are at an increased risk based on their identity, in which existing measures are not sufficient. Because this PSRA comes also to really specifically look at the person. And one recent example we had is the use of this assessment for the LGBTIQ+ personnel who are targeted in a particular challenging context, right? In one of our duty stations, we have also used it to support colleagues from this community. We also use also the PSRA for colleagues who face domestic abuse and violence, or retaliatory attacks such as honor crimes. As you know, we work in some areas where this is where the honor crime is truly a quite significant matter. So it is also part of our organizational duty of care to staff, and to also use our tools in a more cohesive manner to addressing a PC approach, a person-centered approach. The PSRA is also an undertaking between our legal affairs and FSS. This was developed part of the support that came out of the witness support project that UNHCR is really promoting to better support victims and also witnesses. So based on organizational requirements, such individuals have we have developed this to truly support all these colleagues, partners, forcibly displaced people if required, in the implementing partners and also. But now the process, how it works, generally the PSRA it differs from if you have some our security colleagues, they know the PSRA that we use for SUNOs, for senior UN officials. This PSRA is quite different. It's really addressing the issues from a PCA perspective. So it can be initiated by IGO, our investigation office, or the LAS, or our legal affairs, or by the head of FSS himself, or the managers in the field, reps, heads of offices, and etc. And now FSS, it's important to involve FSS in this discussion because the field security service is really the one designating the field security officer who is most appropriate to actually conduct this work, of course, with the consent. And I insist in this consent and the consent of the affected person. We cannot do this without the consent of the affected person. And all of these are done in a very, very confidential manner. But my last point is also, when we develop this, we have a focal point for PSRA in the headquarters, who is my colleague Andorian, who is dealing with this. But if the incident involve gender-based issues, then my colleague, yourself, you have to be involved, which is Bridget Hancock, who is our senior FSO for direct threats. So these are important, just be making sure that we are working in a concerted manner, making sure that we don't leave any stone unturned, and also making sure we do all our due diligences properly before we go and engage with this in a confidential manner, but also with the consent of the affected person. Over to you, Bridget. Thank you.
Thank you, Lee. And I promise I didn't ask him for a plug there, just for clarity. But yeah, no, it's really important because we are really strict on confidentiality. So it's only ever gets shared with someone if the victim or the affected person is okay with that. I want to turn back to you, Sanya. Mainstreaming person-centered approaches in security briefings and security risk management is critical so that people can be aware of the threats that they might face in a context, or the risks or the measures that are in place to help them. How does UN Women provide pre-deployment information to staff before heading to the field or being based in the field so colleagues are empowered to manage their own security decision-making?
Thanks, Bridget. And you actually use a very good word, and it is empowered. And I'll come back to that. But just for the context, UN Women operates in 150 countries, including missions and duty stations. And as a team, a security team, we try to be very approachable. We always encourage colleagues to come to talk to us and ask questions. So I would say when we're talking about traveling to missions and changing duty stations, I think UN as the system has a very good platform where we have travel advisories. Travel advisories include some information about the country, some information about security risks, and then some measures and some approaches that colleagues can take in that country. So that's a very first stop. And this is available to all personnel, all staff. Doesn't matter where they go, doesn't matter are they going for a mission or a duty station, or even if they go privately, this is accessible to them. So this is a first stop. And then what we learned from COVID during those years is that security briefings that we provide to colleagues, it used to be when a colleague comes to a country, they are sent to a security briefing. But because now these are done in hybrid forms, we don't think a person needs to wait to be in the country, deployed in a country, or already be there in the mission to request such a briefing. So we encourage colleagues to request from the offices, from the local offices, to be included in these security briefings. And again, this shouldn't be one-way street. Yes, security colleagues will provide briefings, but colleagues can actually ask questions. So whatever interests them based on their personal needs, they can ask questions. So we're talking about more tailored approach in security, but again, providing a brief range of information. One of the things that we do in UN Women, we conduct a training that is called Women Security Awareness Training, or WSAT in short. And here we have a training that is created by women, delivered by women, to colleagues in field locations. And here we address a lot of security questions. But I just want to emphasize, when I have 25 women in the room on this training, I tell them, yes, I have 25 women, but I have 25 different women. We have a lot of things in common, but we are diverse. And security is not simple that I tell you, you do this and this happens. It's not like that. So we need to count in diversity that we have, and then we turn that into our strengths, and colleagues turn that into their strengths. So I'm back to your word, and this is a very good word. We want to empower colleagues. In that training, in the briefings, in the regular communications, it is important that they feel empowered, that they have things under their control, and they can change the outcome as well. I hope that answered the question, Bridge. You are mute, and this happens from time to time.
It answers the question. And Lee, I want to turn to you about security planning before we move to decision making. How does effective security planning integrating person-centered approaches actually enable our operations? Can you share any good examples or some good practices from UNHCR?
Thank you. So here, the matter is, as security personnel, we must always consider a person-centered approach in our safety and security matters, challenges, barriers, and impediments when we carry out our duties. Now the question also is, as I said before, it's about the how we approach the things for our offices, residential compounds, premises. Physical security and physical planning must also consider all this, including disability and genders, in the design and implementation of our security measures. And that is really how we do it. And some so to come up with the mindset and the attitude of having all this included in all these parameters I just listed. So for us, UNHCR, for example, if I just can pick some examples, if for those who have worked in high-risk stations, Afghanistan, Yemen, Somalia, and so on, we have seen the issues we have with PPEs, with helmets and vests, the personal protective equipment. We have noticed, most of them were heavy, were really difficult to carry. And UNHCR really made an effort, and I congratulate those who really pushed for us to have PPEs which are designed and tested by women for women. So really, this was a good push, and UNHCR succeeded to have that, and be this actually standardized to supporting our colleagues. So this part of planning, I have seen in drills where we have colleagues who could not wear the PPEs because it was really tailored. It was not designed for some colleagues to be able to wear them. So this was an issue. And the last thing I just want to talk about, UNHCR is very much investing on inclusion on colleagues with disability. We have a dedicated intranet page for that. For those who are interested, you have so many resources in that, including guidance, and also how to conduct some training for that, and also in terms of communication, we have all of these resources in that intranet page when it comes to disability. So these are really some of the major contributions that UNHCR is doing now in that sense, and I think we need to do more, of course, and in the coming month and years. Over.
Thank you, Lee. It would be really good to hear from Florence on the roles and responsibilities when it comes to PCA. So what's the role of security officers and decision makers in ensuring a person-centered approach at the field level?
Okay, so there, this change, like many other changes, so complex and multidimensional. We really need to have engagement and commitment from top down, but also bottom up. It has to be, everyone has to be committed, empowered, like Sanya mentioned, but also, there is a need to have a push from the top to get this implemented. We are lucky that in DSS, we have a leadership in the Undersecretary General who's really pushing for both people-centered approach and gender and inclusivity in the department and for the UNSMS, and that has been consistent in the last, I would say, in the last 10 years. But this leadership also replicates and need to be replicated, at the individual security advisor levels, at the in their country level, and it is also replicated in the designated officials, so the resident coordinator, humanitarian coordinator, who are the security decision makers. It's very important that they are empowered and committed to implement this. And I'll give you an example. We have, in Pakistan, the previous RC decided to have gender and inclusivity on the table, and would put that on the table of the SMT and have specific meeting with the area security coordinators and gender focal point on a monthly basis. And why is this important? Because just putting it on the table allow and give space for everyone to think about these issues, to do the research, to do the gap analysis that Emily has mentioned, and to find the solution. If it's not on the table, then there are so many other priorities, a complex security environment. We never think about it. We don't have time. So what happened in Pakistan, thanks to the leadership of the designated official, it also, of course, gave the hint for our CSA to also change things, recruit more women in the security environment, in the security team, to train more people, so they would be able also to train more people at the local level, right? So how did that translate at the field level? Very remote locations in Pakistan. I met one person who told me, you know what, thanks to that, we have been able to identify hotels and, guest houses that were women friendly, where we could stay, even though they were not UN guest houses, but because they had been checked and because the entire community participated in identifying these guest houses, then they could stop and go in these long field missions in the remote locations in Pakistan. So really, I think, it's the top-down approach, but also the participation at the local level that helped our people to really, deliver and in an inclusive manner and have consideration for everyone's need. So we also have gender focal points in DSS, and we will be using them a little bit more than we used to in the past, to continue this effort, and translate this effort into a proper action. Thanks.
It's really exciting to hear that, Florence. And I think I was in Yemen late last year, and there was a very similar issue in regards to guest houses. And once we actually found a solution, it didn't only enable women to go to this location and for us to continue operations, but men could then go there now too, because they felt that they didn't want to be discriminatory and say only this group of people can actually access this part of the field. So they just stopped operations altogether. So it really, a person-centered approach is inclusive for everyone. I'm turning to you, Ika, because I want to talk about training. Understanding the role of the decision makers and security colleagues that Florence has just mentioned. Marika, how does training and learning support managers and security officers in implementing this person-centered approach?
Thanks, Bridget. Training and learning are one of the most effective tools in raising awareness and understanding of principles, policies, and other guiding frameworks, which is why it is really critical to include the mainstreaming of person-centered approach in security management for all learning programs for security decision makers and security personnel. Remember that security personnel are the advisors to security decision makers. For security personnel, without fully understanding what a person-centered approach is and how to operationalize this in their day-to-day work, they will not be able to effectively advise their security decision makers. As a result, the security decision makers will also likely to fall short of carrying out their accountabilities, responsibilities, and roles when it comes to integrating a person-centered approach in security risk management system. And as what Florence mentioned, empowered leadership is one of the key factors in successfully implementing a person-centered approach in security management. Now, for us trainers, we say that we have successfully delivered a training when there is a change in knowledge, skills, and attitude. Among these three learning domains, a change in attitude is said to be the most difficult to achieve and could take some time and most difficult to measure. Now, for a learning program for security decision makers and security personnel, I personally believe that a change in attitude is the most important learning goal when it comes to implementing a person-centered approach or a training program for that. A security decision maker can be fluent in their understanding of the UN Security Management System's guidelines on disability considerations, and security professional can be very skilled in integrating diverse personal risk profiles in security risk management process. But if they are not aware of their own personal biases or willingness to address them, or even, financially or process-wise, they're not willing to pay for that extra bucks for ensuring measures for security or for personnel with disability in case of fire or building evacuation, then all these knowledge and skills will mean nothing. So for me, I'd say that more than understanding and skills, it is crucial for learning programs for security decision makers and security personnel to also target a change or enhanced attitude towards the implementation of a person-centered approach. Over to you, Bridget.
Thank you, Ikar. And I recall having a conversation also with Melanie on Human Rights Watch's training and how you're integrating a person-centered approach in this training. Can you tell us more as well?
Sure. So we do a number of different kinds of security training at HRW, but the one I'm going to focus on right now is our hostile environment training, because I think it's probably the one that is going to resonate the most with people on the call. So when I started at HRW 3 years ago, we were relying on external providers to provide our HEAT training for staff. And part of our person-centered approach to security involves really proactive seeking of feedback from staff about how is this security protocol or training or whatever we're doing working for you? Is it meeting your needs? Is it not? What do you need us to do differently? And overwhelmingly, the response that we were getting from staff who were going on these external courses was, this is not meeting my needs. Some of it was the curriculum was just not relevant for the human rights sector, because it tends to be focused either on humanitarian workers or on media. And we kind of operate in this unique niche spot, sort of in the middle of both of those. We were also getting complaints about the trainers themselves and the way that they were interacting with staff and showing up in that space. And then the methodology as well. It just wasn't trauma informed. And when we talk about person-centered approaches to security, I think we can't ignore the fact that trauma-informed practices they go hand in hand with that, because every person has experienced forms of trauma in their life, and that may carry over into traumatization and show up in how they're showing up in spaces, how they are engaging with security teams, because oftentimes that trauma has come from past security incidents, experiences, or interactions, unfortunately, with security staff. And I think that's so important when we're approaching our training, is recognizing that, first of all, this training has the potential to traumatize or re-traumatize staff. And if staff are afraid to come on a security training, we have done something fundamentally wrong from the very start. So, part of bringing this in-house was about making this more person-centered and meeting the unique needs of our staff. But secondly, the first day for us, it's a 4.5-day course. It's all about the foundational principles of security management, both at an individual level and a team level. And so part of one of the morning courses is all about identity and risk, and how do different people's experiences of their own identity from context to context either increase or decrease vulnerability to different types of security threats. Part of that is to give people just their own time to think through what this means for them in the different locations they have been, but also where they might go and how their work intersects with that. But it's also to create risk empathy among everyone else that they're going to work with, because we recognize that, yes, our people often work alone, but they often do work in small teams of 2 or 3. That could be a fixer that they bring in. It could be a driver. It could be another HRW staff member. And so we have them look at, what does it mean to be an individual within a team of people with different risk profiles, different fears, different concerns. And we then move on into bystander intervention methodology, so that our staff do know how to step up and support other people in that scenario, not only look after themselves. Back to you, Bridget.
Thank you, Melanie. And I think this is something where we are behind on in the common system, in terms of how we're integrating these sorts of individual elements and individual personal risk into the way we look at and inform our colleagues in training. So I think there's a lot of lessons we can learn and take from you here. UNHCR implements a person-centered approach in security risk management workshop for security officers. Lee, Ikar talked about changing attitudes. What's your experience? Do these workshops really address core issues of bias and racism and gender discrimination? Do they have an impact?
Well, we started the PCA workshop, the person-centered approach workshop, back in 2019. So we started it with a number of colleagues. Unfortunately, COVID came, so we had to stop, and we had to resume it in 2022. Since then, we have trained lots of staff. We have trained quite a number of staff globally. And from my perspective, from where I'm sitting, I have witnessed lots of progress in our security management approaches, in the way colleagues are really now approaching security management. Was that easy? No, it was not easy, because the topics we were working on covered some sensitive items. Some it can be even uncomfortable for some in some instances, but it forced us to reflect on our own biases and have difficult conversations. So that, to me, that was really the starting point, and that, to me, allowed us to because we give the chance to colleagues also to revise their biases, look at their own internal ways of actually dealing with things. And throughout the training, it was interesting to witness from day 1 to day 5 how colleagues moved from, very, I could, for a better word, I would just conservative. I would just use the word conservative, a very conservative approach to what, this PCA tool, understanding it, being able to implement it, is the way to go, because it will help me to do my job better. It will help me to serve the colleagues better. And some of them even later came before the end of the training, telling us how they now see and perceive how wrongly they were doing some things, and even commit to go and change the way they were actually dealing with some of these matters related to gender and etc. So and what I have seen whenever I go to the field and I look at those who went through the training and those who did not go through the training, I clearly see a clear difference, because they have been exposed to different things. That's why I'm one of the advocates and who believe that we should do more of these trainings, because I can witness change. I can even witness transformation for some, and it has an excellent impact on the colleagues. You see the attitude and the mindset has really evolved in a way that colleagues are telling us they're able to do their job better, because now the colleagues who are in the field feel that they have better services, they have better management of security in some instances. So they come forward with their issues and matters to hoping that they can help more help. So to me, this was an excellent training. We really need to promote it and keep going. Over.
Thank you, Lee. And Ika, what are some of the best practices that you see and some of the challenges that you see when it comes to person-centered training?
Thanks, Bridget. We can talk about this for hours, but I think, Melanie has shared some of the common challenges and best practices to security trainings similar to HEAT and SAFE. So it's similar for us. So I think I'll focus on the Women's Security Awareness Training, or WSAT. As Florence and Sonia mentioned, the WSAT is one of the trainings that we have in the UN Security Management System that is part of a wider UN SMS program and person-centered approach. Now, when it comes to WSAT, I think the biggest challenge in IOM, and I think I can safely say that this goes for all other organizations as well, is that WSAT is often used as a band-aid approach to incidents, or a check-the-box exercise to say that a person-centered approach has been mainstreamed in security management. So, for example, I've seen security risk management identifying WSAT as a security risk management measure for an active shooter event description. So I think, so that's why for IOM, because we have a very limited number of WSAT trainer, so it's really important that the prioritization is done when it comes to delivering or supporting WSAT. So for us, we do this by doing a desk review of the country documents, such as the SRM, travel advisory, incidents list, etc. And then we also engage with the country office management and other relevant departments, such as the staff welfare office, to understand what really is the need for the WSAT in that location, and to also make sure that we are appropriately delivering the WSAT in that location. And then the second challenge, I think, for us would be that I have observed is the lack of contextualization in many of the in some of the WSAT deliveries. I'm not saying all. For me, an effective WSAT is when you really tackle down the women-specific risks in that location. Noting also that even amongst women, it is likely that we will have different levels of risk based on diverse personal profile. And I think this is also what Sonia was mentioning earlier. So what we've done in IOM is that we've standardized our WSAT package for trainers, which includes discussion on understanding diverse personal profile. And we have also pre-indicated sections for our trainers to integrate the local context when delivering the WSAT. So I think this has helped our trainers in making sure that their WSATs are contextualized according to the local context. I also encourage our trainers to work with subject matter experts, such as our GBV specialists or protection officers, etc., whenever they are contextualizing their materials. Over to you, Bridget.
Thank you, Ikar. And I think this is a good time to kind of make a pivot and look at diversity, equity, and inclusion and from a policy framework. Emily, I'm curious to hear from CRS on this. How does diversity, equity, and inclusion and the lens of DEI, using this lens to implement policies and procedures, meet the needs of personnel?
Thanks, Bridget. So at CRS, we have a respect, equity, diversion, and inclusion team that leads our DEI initiatives, and they guide our agency-wide DEI strategic initiatives and competencies. They use data from our employee engagement surveys as well as employment trends, and then our DEI team implements these cross-cutting initiatives to meet the needs of our nearly 8,000 staff. Now, this can look like very different activities or approaches, right? There may be opportunities for individual or group training, language inclusion services, diversity hiring practices, disability awareness and inclusion, really highlighting the importance of psychological safety and our process for requesting accommodations so that staff feel empowered and supported in doing so. We have found that by implementing DEI practices through every phase of the employee life cycle, we are more likely to identify and then meet the needs of our diverse staff. So if we're going to talk about other specific examples, I think it's important to kind of dial back and look at some specific ways in which we've done this. So for equity and inclusion, we are developing a policy that relates to the emergency financial assistance of our national staff, right? It's intended to support colleagues in country after a catastrophic incident or security incident, conflict, natural disaster. And there are some perceived inequities in how national and international staff might be treated differently following some sort of catastrophe. And that's really influenced our approach, is how do we make sure all of our staff feel as though they are supported, they are being taken care of, and that we are fulfilling our duty of care. And sometimes you have to start with addressing those inequities, right? The disparities in approach. When we consider the diversity perspective, one telltale sign for us has come from our engagement survey data, where we notice that there are trends for women in a conflict-affected region respond significantly differently from the trends for our male respondents, right? Particularly as it relates to their individual perceptions of safety and security. And so we have to pull that information out and allow that to tailor our approach in those areas. In two of our country programs in West and East Africa, we have also developed female-led security working groups, where our female staff are empowered to identify and address the safety and security aspects that are key to them. And one way they've done this is by starting with, well, my day starts in my home, and then I travel to the workplace, and then I'm in the office, and then I'm out in the field, and then I end my day back in the workplace or at home, but they kind of walk through what their daily routine looks like. They identify the areas that are pain points to them, and then they problem solve and then engage with us on how they can put a plan in place. And we found that by engaging those staff-led or gender-led teams really gets a different level of buy-in when you start to put that in progress. And I think, gender is important to include when we talk about identity, but we also have to include all the other groups that make up a diverse staff, right? So it's the ethnic affiliation, religion, disability, language, veteran status. I mean, there's so many different things. And sometimes I think we can get a bit pigeonholed and we just think about diversity and we maybe think about gender or one other aspect. So I think that's equally important as well, is to make sure that when we talk about diversity and we talk about inclusivity, we are not just looking at one specific group, but rather looking at multiple groups, and then looking really at the practical policies that are supporting them and asking ourselves, are these policies inclusive? Are they promoting equity? And if not, then we tackle them policy by policy.
No, I think this is super interesting. And one of the things a leader in our organization talks about is one thing to have diversity, but do we have inclusion? Does everyone feel that they can be equally represented, equally heard, and equally listened to? I want to ask colleagues to put their questions in the Q&A. I know that there are some in there, but please feel free to continue to add. And we'll get to those shortly. We have a few quick questions, kind of a speed round of questions for our panelists left. I want to look at incident management quickly. So in terms of managing security incidents that occur or are targeted based on who someone is or what they may look like or their personal characteristics, Marika, what are some of the best practices or areas to improve that you've seen in the security industry in managing incidents?
So I think so for me, when we talk about one of the best practices or more of the positive things in the UN security management system when it comes to security incident management is actually it was the promulgation for me. The promulgation of the Gender Considerations Manual is probably one of the biggest contributions in the UN security management system. I mean, having guidelines that outlines the key principles of supporting affected persons and options and how they respond to gender-based security incidents are, very important tools for security personnel. Now, I say that, however, an amazing document does not automatically equate to successful operationalization or implementation. And I think that is one of the areas, one of the key areas to improve when we talk about incident management or best practices, or how we can improve, incident management when it comes to gender-based security incidents or incidents affecting individual personal characteristics. A good policy in documents like the Gender Considerations Manual will fall short if security personnel do not even know what the guidelines, if that these guidelines exist, or how the guidelines, what to do with them, basically. And one of the best practices, and I'm going to go back again to, sorry to link this again to training, because this is really important for me, that, we enable our security professionals in responding to gender-based security incidents or profile-based security incidents by giving them or integrating this person-centered approach, or how to address them in learning programs for security professionals. I mean, for example, when I teach the Field Security Associates course, one of the things I like to do on the topic of immediate response to gender-based security incidents or profile-based security incidents is to review a fictitious scenario and then write a security incident report. And then what I find often is that despite the existence of the Gender Considerations Manual and, having them to read it, requiring them to read it, security personnel sometimes still struggle to draft a report or a security incident report that protects the identity of the affected person. So for me, think that there are some certain areas in management of incidents or reporting gender-based security incidents that we can improve by strengthening the trainings in relations, training for our security personnel and integrating these areas of security. Over to you, Bridget.
Thank you, Ikar. And Emily, what aspects of care or standards of care can we apply from the medical side of organizations to better care and support for our colleagues who might be affected by security incidents?
Yeah, I think one aspect that's been really instrumental in providing support to those affected by security incidents is first by defining our duty of care, but then also thinking through how do we apply our duty of care, not only during the incident, but through the entire duration. And so for us, that really starts with before, right? What do we do to mitigate risk and prevent, educate, train during the incident, and then also after. We also tend to use the term health rather than medical, as we recognize that health includes both our physical health, but also our mental health. And we want to approach our response as holistically as possible. At CRS, we have had the opportunity to build out a multidisciplinary health operations team who works as part of our larger health, safety, and security unit. And so this originally included myself, but now we have a physician, a nurse, a psychologist, and a health benefits specialist on this team. And this approach is certainly more comprehensive, but it allows us to really address the many facets of a security incident. So whether we are partnering with our security advisor to craft a safety plan, we're providing family outreach, facilitating a health evaluation, or emergency healthcare, guiding someone on how to file an insurance claim, or helping connect somebody with a provider who can provide trauma-informed care. We feel like that has really strengthened how we respond in an incident, and that it's only grown stronger in time. Now, I recognize that many agencies may not have access to that same sort of multidisciplinary team approach. So I would encourage use of both internal and external resources, and really dedicate time to map out what a holistic response looks like within your duty of care.
Thank you, Emily. I think there are a lot of lessons that we can learn from the health side of the house. Marika, your final question for you before we turn to Q&A. You're currently the co-chair of the UN's Gender and Inclusion Working Group on Training. In your view, how should person-centered approach be integrated into security training and learning and development?
Okay, thanks, Bridget. All right, so basically having one slide in a security training describing what a person-centered approach is does not necessarily mean PCA was actually integrated. PCA mainstreaming in security training means integration from structural design, setting of learning objectives, developing materials, organization and planning, and actual delivery, post-course evaluation, and so on and so forth. So how we mainstream PCA in all aspects of training design, development, and delivery will affect the learning outcomes for the participants. As a trainer, if a learner comes out of a security training saying this is not relevant to me or there was no added value, then I'll start reviewing the learning program again. So PCA mainstreaming will mean different things from different audience. I mean, I think everyone here has mentioned about, different risk profiles and the importance to recognize this. So as I mentioned earlier, for security decision makers and security personnel, it is important that learning programs not only targets the knowledge and skill domain, but also the change in attitude. This is because we need from this group of actors in security management stronger support and commitment to implement measures, policies, guidelines when it comes to PCA and security management. For security trainings targeting personnel, and this is what Melanie has expanded more earlier with regards to their HEAT program, it is important that personnel find security trainings relevant to them. There is value added to them, and they receive appropriate understanding and skills on how to address the security risk specific to them as individuals. And these are the elements that we need to look at when we are delivering and designing trainings. So I think in my last words on this is that standardization of security trainings are crucial, but standardization does not mean a one-size-fits-all training is the best way to do it. And what a person-centered approach means is that integrating it in all aspects of training delivery, from training design, from start until the very end of a training delivery, which is on post-course, requirements and everything. Over to you, Bridget.
Start to finish. Yeah. And UN Women, Sanya, what role, final question of the panel today, can security play in creating or facilitating an enabling environment for this person-centered approach?
Thanks, Bridget, for that question. I think the role of security is fundamental. Generally, we are here to enable our organizations to deliver their mandate. That is the role general that we have to do. So we have to have trust of colleagues, and we also have to promote inclusivity. And then we have to turn back to our security departments and security team and see, do we do the same what we tell others to do? Are we diverse in our teams? And here I think there are two benefits to having diverse security teams. One is from perspective that if we have persons of different backgrounds, different gender, different races, nationalities, ethnic groups, persons with disabilities, when we look at security risk management, when we look at plans, all of us bring different lenses. And then we work together to actually have a better approach to these questions. And in UN Women, this is priority. This is why we have 50-50 gender parity. This is why we have persons of different backgrounds and different nationalities and so on. And then another part of this benefit is actually who is benefiting from this, the colleagues on the other side. Because having a team that is diverse means that colleagues have choice. If they have questions, if they have concerns, they have choice to come to any of us from the team. And sometimes this is culturally. Sometimes colleagues will not express their security concerns to their team members because of the context, because of the culture. Sometimes it's opposite. Sometimes if I come as a foreigner, they will not be talking to me. So we need to give them that choice. And when we look at colleagues who had some security incidents, it sometimes is a part of a coping mechanisms. They will talk to a person who is similar to them, who they can trust, who they think can help them. So having actually possibilities for them within the team and having this diversity is what I think is crucial. And each of us then should look back and see, are we the best fit to support the colleagues on the ground? And I hope this is a priority for all of us in all organizations, UN and outside of UN in the future. Thanks.
Thank you, Sanya. And I think that leads us perfectly to an interactive discussion with our colleagues and participants online. So I've got a list of questions here, and some of them are quite spicy, shall I say. So let's see, I'll put them to the panel, see who wants to answer them. And colleagues, please, just a reminder, if you're listening in, please do put your questions in the Q&A. So we'll start off with the first question from Libya. Given that certain countries may not accept individuals with specific profiles due to nationality preferences or religious beliefs and so on, would it be prudent for security managers to advise against hiring individuals with these profiles for positions in these locations? This could potentially mitigate any risks because you're avoiding the risk altogether. Any colleague who wants to answer? Sanya, you were first, I think.
And then I'm going to pass to Marika. If I think about that, easiest would be to say to colleague, no, you cannot work in that duty station because there is a security concern, you have a security risk, and that's all. I don't think it's a way to go. I do encourage colleagues to talk to a colleague who wants to come to that duty station and work. We are hiring adult persons. They need to be aware of what security situation is, what is the risk, what measures the agency can give them to support them, what measures they can do to support themselves, and then based on this, make informed decision. And then we are here to support them. For any type of diversity, I think just conversation, and a person will realize, are they putting themselves in a too high risk based on what is on the ground. But just to say no as no, I think we need to be bit more prudent about that and more careful about that, because as UN or as international organizations, we also want to have diverse workforce. So that can be a security, then we are here to support UN in doing that. Marika, over to you. Please add.
Thanks, Sandra. Bridget, I think it's the same or along the lines of what Sonia mentioned, but maybe to add on that is we've for the UN in the security security management system, we've moved away from a risk averse approach ages ago, and it actually defeats the purpose of a risk management approach to advise such a thing. And I personally believe that as security professionals as well, it is not our job to discourage hiring, because again, the focus should be risk management, which is what Sonia has explained or expanded, that there are steps and ways on how we can look at how to provide measures, and then the individual or it should be the individual's decision to whether it's appropriate for them to be deployed in certain areas or things like that, based on an informative process. Over.
Yeah, and I think it goes against the whole concept of inclusivity when we say not yes, but not these people. That is essentially saying diversity, but not inclusivity. I want to ask another question now. We've had another really interesting question. What are some of the common challenges or barriers that organizations may face in a person-centered approach, and how can we overcome these barriers? Melanie, hot off the mark.
Yeah, so I think I can answer the first part, not the second part about overcoming it. For us, the biggest enabler for our approach to centering people at Human Rights Watch is that we have the funding to do it. We have about 600 staff. We have a security team of 3. And we know everybody. We have the opportunity to have those one-on-one connections and relationships, and we have a leadership team that recognizes that that's important and that we need to staff the roles to be able to have those. And part of bringing our HEAT course in-house was also to give us more face-to-face time with staff so that we were building those relationships. So I realize that most of you on the call probably don't have the decision-making ability for funding. I think Human Rights Watch is also in a really beneficial position with funding because we don't accept institutional funding. That's part of our ability to maintain our independence and credibility in what we choose to research and how. So we have a lot less stringent requirements on how that money is spent. So we are able to invest more in security staffing to be able to enable those relationships with staff.
Thank you, Melanie. And it's nice to hear that you have such nice resources. And I think we'd all love to hear the same from our organizations. Florence, over to you.
Yeah, I'd like to respond to the second half, how we can overcome, because I think we have, identified a number of the challenges. And to be honest, it's not easy. That's why we are discussing it, right? And it's a journey. And it takes a lot of commitment and partnership as well. Partnership for us, in the UN security management system, is partnership with the other organizations to really break the barriers, do the training, convince people, empower people, and do what we need to do to really make this happen and make this implemented. I think it's partnership also with our colleagues, from all the NGO community also, who are, because of the size, and that's what we are discussing, are able to, implement practices that we have not thought about because of our size, because we're thinking globally and we're not thinking individually. So that's why this partnership again is important. And again, I think it's really also the realization that this is not going to be overcome in like 1 year, 2 years. This is a long journey, and we need to be prepared to maintain our effort over a long period of time. So it means that we need to invest in the people we are actually, we have in our staff, and also our staff, at large, because we can count. I mean, we should count on them also and listen to them. They are the ones who are benefiting from this new approach at the end.
Yeah,
Thanks.
definitely. I think that's one of the cross-cutting themes of this whole conversation is our listening. We've had a great question that's just been added to the chat. Are there any considerations for LGBTQI plus colleagues or related diversity variables when considering a person-centered approach? I know we've talked a little bit about that today in terms of sexual orientation, gender identity, and Lee, I know you gave some examples from UNHCR, but what other considerations do we make when it comes to security for our LGBT colleagues? Melanie.
Yeah, I'll give a really practical example of something that has gone wrong for us at Human Rights Watch. So we had hired a consultant to work for us in a very conservative location that was quite condemning of LGBT people in general. And we had hired them to do work on that issue in that location. And one thing that we were aware of and had planned around was how this had to be kept secret from their family. So it was a woman who, she also had a same-sex partner in a different country, and none of that was known to her family. But even the fact that she was researching on this issue in that location would have brought significant shame to her family. And so we had developed a lot of protocols, like her working hours were when her father and brothers were not in the house. She would only conduct interviews in English because they didn't understand English. Like, we had really done a lot of work around this, but we had also missed a couple of potential vulnerability points, and we did have to end up getting her out of her house in the middle of the night and flying her to a different country very, very quickly. And so what that highlighted to me was that I think we often forget about people's home lives and what's happening in that very personal space that could be linked both to identity and also to the type of work that we're doing. And that was the first time that I'd ever seen that play out.
Thank you, Melanie. And I see Sonia's put up her hand as well.
Thanks, Bridget. I can give you examples from UN Women, because we had a couple of cases where colleagues who are part of LGBTIQ came to us and said, I want to go to a mission to this country. What is my risk and what I'm going to face there and how I can overcome? So in those cases, it's a personal security plan that they get from us. It's a personalized approach, because even when we talk about LGBTIQ, we're talking about different groups of people within that community. And every person has different concerns. So in that case, we did provide our advice, and then a colleague made a decision, and I think it was very appreciated. We try to do that as much as possible, especially if we're talking about colleagues who are in certain groups that maybe they look at travel advisories, maybe they look at security risk management, and they at this point still say, I'm not sure that I'm included in all of this. As a system, and Florence said this correctly, it's going to take time to make all these changes, but that doesn't mean that colleagues then can just take it as the answer. They can approach to us and say, okay, I need solutions now. I need your advice now. Thanks.
Yeah, absolutely. I think one thing here that UNHCR and some other organizations do a lot is we have LGBT groups within our organization, but also, for example, UN Globe. So we liaise with them. We also, because often colleagues don't feel comfortable necessarily directly approaching security, either because of their concerns or they don't want to be outed or whatever their individual concerns are. So what also groups can we access to get information about how colleagues might feel in a certain context is super important. But certainly a cornerstone to the person-centered approach is LGBT-related concerns. So thank you, Anonymous. I want to probably wrap things up now in terms of the Q&A and turn back to the final reflections for the panelists before we close today. What concrete steps, if you could name one or two things that colleagues listening today or participants listening today could take to operationalize this at the field level or in their organization or as a donor, what steps can they take to create a person-centered approach or enabling environment? And I'll turn to Melanie first.
Sure. So I would say lead with your own vulnerability. And that's because in order to support individuals, we need to understand both the real risk that they're subjected to, but also their perceived risk. And so much of that relates to their fears, and that's not going to be obvious to us. And a workplace environment, especially when you're talking to a security team, is not necessarily a psychologically safe space to talk about what you're afraid of. And I learned that from my own personal example. So a couple of years ago, I worked at an organization that was a dog-friendly environment on Fridays. So you could bring your dog to work. And many of you are probably smiling and thinking that sounds great, but I have had a lifelong phobia of animals, but especially dogs. And I was always really embarrassed by that and especially tried to hide it in a workplace scenario. But I had to come clean, go to HR and say, look, I'm terrified of dogs. I can't function in this workspace on Fridays. Can I work from home? And so word got out, oh, Mel's afraid of dogs. And but it was in a very, very caring, compassionate way. Within a week, I had a number of staff come to me and, some of them said, I've avoided going on a HEFAT course because I'm afraid of snakes. And these courses are only offered in places with snakes. I've had other colleagues say they call into work sick every Friday because they too are afraid of dogs. And it opened up a space for me of intimacy with so many other colleagues that I would not have had I not been vulnerable myself about what I'm afraid of, which is not what most people are afraid of. So I would say lead with your own vulnerability.
Thanks, Melanie. And that's a really interesting example. Florence, final thoughts.
Yeah, I would advise, if there is one advice, is really to reach out to other organizations and colleagues who have more experience in implementing person-centered approach to help you and us actually to make these changes. So that's my personal, I think, approach to it. And I think we cannot just make this change alone. We have to work together to do it, to make this change.
Inclusivity in action. Sanya, over to you.
Thanks. I would say, and this would be my advice for colleagues, is look who is on the other side. It's not paper in front of us. It is people that we support. And those people have their concerns and their needs. And having the dialogue that we actually talk to them about this will help all of us to do our job better. Thanks.
And Emily?
Yeah, building upon Sanya's comment, I would say don't get so mired or stuck on one central approach that you begin to meet the needs of the agency before those of your staff, right? Make sure your goals are aligned with your approach. And if you are truly working towards a person-centered approach, you need to make sure that that individual is truly the center of your approach.
Thank you, Emily. Lee?
Yes. So to me, the first thing, the change start with ourselves, with you. It starts with you, with the way you communicate with the colleagues. If you start with not having an inclusive language, an inclusive communication in meetings, in corridors, in the just social gatherings and meeting colleagues. So that's where you lose or you gain people, you gain colleagues. So people don't come to you because you don't have an inclusive language. People come to you because you have an inclusive language, and then they feel that they can come to you with their issues. So if colleagues don't come to you, you have to question yourself. They are not coming to security. No, they are not coming to you because you are not having an inclusive language. So I think that's a starting point. The way we communicate with colleagues, the words we use, the languages we use, and that is to me the key to everything else. Okay.
Thank you, Lee. And finally, Ikar.
Thanks, Bridget. So one last thing for me, security decision makers and security personnel plays a crucial role in implementing a person-centered approach in security risk management. So on a training and learning perspective, we really should aim at targeting change in attitude when designing and learning programs for them.
Thank you, Ika. And I think that's such a well-rounded summary of our great discussion today. And I want to thank all of the panelists, Melanie, Emily, Lee, Ikar, Florence, and Sonia. Thank you so much for joining today's panel and being so passionate about this topic. It was great to have so many participants on the call. Please do reach out to the panelists if you have questions. We will put the recording online for colleagues who are not able to join. We have a number of sessions coming up in the next couple of days and weeks, so please join us for more conversations around humanitarian security. And if you're in person in Geneva next week, we look forward to seeing you then. So have a great rest of the day. See you soon. Bye.
Thank you.